What is gestational diabetes and how is it different from other types of diabetes?
Hey, my name is Dr. Caroline Mithi, a physician and endocrinologist. Gestational diabetes is a state of high glucose in pregnancy, especially from around 20 to 24 weeks in pregnancy.
What are the risk factors of developing gestational diabetes during pregnancy?
Some of the risk factors for developing gestational diabetes include one will be lifestyle, where you have sedentary lifestyle, a lack of exercise, poor nutrition, where you have foods excess in glucose and carbohydrates, and also obesity or rapid weight gain, especially during pregnancy. If you've had a family history of gestational diabetes, that is also a risk factor, or if you've had gestational diabetes in a previous pregnancy, then you're at risk of developing gestational diabetes.
How is gestational diabetes diagnosed and what tests are typically used for screening?
At around 20 to 24 weeks, you may be sent for an oral glucose tolerance test, what we call OGTT. And basically, this is to diagnose diabetes. So you're given some bit of glucose to take. You take glucose, and then we check your sugars at initial visit. And we also check your sugar at 1 hour and at 2 hours. And there's some values that we check for and see if they're above the normal values, then we say that you have gestational diabetes.
What are the potential complications for both the mother and baby if gestational diabetes is not managed properly?
The reason we're very keen for checking for gestational diabetes is the complications both to the mother and to the child that may occur with gestational diabetes. So to the child, the baby will get what we call fetal macrosomia, where the baby is excessively big for his age, which is not good because the heart enlarges and the heart becomes big, and sometimes it can fail to beat. And this may cause stillbirths in the fetus or in the baby. Other things is because of how the baby is big, these may present with shoulder dystocia, especially when you're having a vaginal delivery, where the shoulder gets stuck and fails to come out during the delivery. Other risk factors will be that the baby may develop hypoglycemia, meaning his sugars may go very low, especially after birth. And so these children have to be monitored at least for the first 24 hours in hospital for their sugars, and just make sure that their sugars do not go too low, and this may cause their fetal death. The other risk factors in the baby that we worry about is respiratory depression, meaning that they have a hard time breathing, especially once they're out of the uterus, and so they may need to be observed and possibly put on oxygen after delivery. For the mother, gestational diabetes may predispose you to actually developing diabetes later on in life. And so, on an yearly basis, we'd check that you do not have diabetes that has developed secondary to that. Also, around delivery, you're prone to getting excessive tears, especially around the perineal region. And this is because of the how baby is big at the time of delivery.
Can gestational diabetes be managed during pregnancy?
The management of gestational diabetes is twofold. One, depending on how severe the gestational diabetes is, and this after the OGTT. So the mainstay of management is lifestyle change and nutritional therapy. So we'll send you for a nutritional review, and basically what we are supposed to do is one, get rid of your processed sugar, that's your sugar in tea or any form of sugar, any sodas, any soft drinks in your diet. Embrace a life of vegetables, meaning that each of your meals should have a vegetable and half your plate should be vegetables. And then the rest of the plate, quarter of it should be proteins, and the other quarter will be unprocessed carbohydrates. And these we're looking at whole grain meals, whole grain breads, and also arrowroots, cassavas, so things that you get in the ground that are not processed. The other mainstay of therapy is exercise in gestational diabetes, and this will be you're recommended to do at least 30 minutes of exercise. This could be a walk, swimming, a light jog as cleared by the doctor, what it is that you can do. And also, any form of exercise will be warranted, at least 30 minutes every day. The other thing for managing diabetes will be medication. So initially you put on a tablet. The tablet is called metformin, and this usually helps the insulin work better, and we will increase the metformin as needed. If we notice that your sugar is not well controlled, even as the pregnancy continues, then we will introduce a form of injectable called insulin. And this you'll be given the insulin to be taken with every meal, and that's an injection. It is a simple injection which is easy to manage. Key to note is that after the delivery of the baby and the placenta, your sugars will go back to normal, especially if you did not have pre-existing diabetes. So for the gestational diabetes, it's brought about by the placental hormones. And once the placenta is out, your sugars go back to normal. However, like I mentioned, the risk of developing diabetes is high later on in life. And so the nutrition and the exercise will still persist even after delivery of the baby. So gestational diabetes is more common than we'd like to think, and this is because of our sedentary lifestyle. And so this is a key to all pregnant women. At 20 to 24 weeks, please present yourself to hospital and request to have the OGTT test. And once diagnosed with gestational diabetes, embrace nutrition, embrace exercise, and be seen by a diabetologist or even your obstetrician and gynecology to prevent the complications. Thank you for watching, and see you next time.